All right, recording. All right, here we go. 12 o'clock my time, 12 o'clock your time, 3 o'clock Eastern Standard. Here we go. So, hello, everyone. My name is Mike Lindstrom. If we've not met before, is our virtual hello. I'm a business consultant, author, professional speaker, now virtual Zoom trainer. I became that in the last year, a la COVID, because that's the world it's been relegated to. So, I want to tell you a little bit about my background, how this came to be. So I graduated from law school and I went to go work for Tony Robbins, a motivational speaker, back in 1998. So that's where I got my teeth cut in the world of motivation, if you will. But one of the things that I learned working for Robbins and the organization was we always believed in modeling. Modeling was the duplication of success. If someone else could do it better, go follow the formula, right? Model that individual's success, their beliefs, their physiology, their routines. When do they wake up? What do they eat? What do they drink? How do they become that healthy? How do they look that good? How do they become that successful? So I've always been a huge modeler. In my practice in coaching, I do business coaching. I work with individuals, doctors, lawyers, insurance, entrepreneurs, startups, you name it. I mean, I work with 30 to 40 individuals at any given time. I work with organizations and do training. So I have a dear friend of mine that I went to college with at UC San Diego, Dr. David Dahimi in Orange County, California, who's actually a fraternity brother of mine, who I've been working with for years and years and years, anesthesiologist, but his passion is addiction medicine outside of what he does in his quote unquote day job. And we've been sharing notes the last couple of years about his practice, assisted, basically his clinic that he has, MAT clinic in down Orange County. And we used to start talking about people he knows and people that I know. And he said, I got a guy that I work with, you got to meet. He's a passionate guy. He's got a ton of energy, through the roof, entrepreneurial spirit. And lo and behold, he makes an introduction to my friend, now I call dear friend, Dr. Steve Garber, who's joining me today. Steve and I met pre-COVID, and he's in Orange County. I'm in Phoenix, Arizona. And the first call we had, I remember it vividly, we just gelled. He was talking about his vision and the things he wanted to do. And he just didn't want to just be a doctor that was just practicing medicine, right? He wanted to change the world and do all these great things. And I'm like, goodness, this is my kind of guy. He's entrepreneurial. These are the kind of things that they don't teach in med school. I went to law school. They don't teach in law school, go change the world. They tell you, pass the bar, become a DA, go work at a big firm and go follow the partner track, right? I mean, that's what we're taught in law school, very similar in medicine. So when Steve and I, during COVID, we were comparing notes about the things we were doing to pivot to bring more value to the people around us. And I told him about webinars. And I knew Steve was doing partnerships and all these great things outside of the hospital, if you will. And I said, Steve, we got to get together on this. This is modeling 101. I get to model you a successful story of someone who's an incredible doctor, but also an incredible entrepreneur. Would you do it? He's like, absolutely. I do these things on live stages. I do these in committees and maybe with small groups, but to take it to a bigger platform. So here we are. So the pitch was real simple. He was excited to join me. So today I have my friend, Dr. Steve Garber, for joining me today. So Steve, thank you. Did I mess anything up on the introduction? Is that about how it happened?
That's exactly right. And it's such a pleasure and really exciting to be working with you, Mike. I mean, you've just energized me and just shown me so many things. I mean, just little things. I remember where the energy flows, the focus goes. I mean, it's just little things like that that are really exciting. So thanks for doing this for me.
Oh, absolutely. Absolutely. So as you're listening today, I want you to listen for multiple ears. Number one is modeling entrepreneurship. I think that's one thing that we're going to talk about today, what's made him successful, what he does, and think outside the box from traditional medicine. But there's some topics here that are very near and dear to my heart. And I'm going to explain that to you and some of my personal story that relates directly to Dr. Steve Garber here. But Steve, tell us a little bit about your story. What are your background? How the heck did you get to this place? Did you just know you were going to be a doctor and go into anesthesiology and be here today? Tell us the story.
Oh, well, no, I didn't know I was going to be a doctor. It was like, all kids in college, you're thinking about this and that. I was thinking about law for a while, and I was in science. So I said, okay, do pre-med. Anyway, college at UCLA, UCSB, and medical school at UC Irvine. And people always ask the question, well, how did you pick anesthesia? And the truth is, anesthesia picked me. It's one of those things when you're going through, and I thought, I want to do emergency room. No, I want to do family medicine. or I want to be an internist and a cardiologist because they're the smartest people on the planet, or I want to do this. When I did a rotation in anesthesia, what you find is that when you're in the operating room, you are the pulmonologist, you're the pharmacologist, you're doing all of those things right there. So it was kind of a perfect fit. Plus, I really like to do things with my hands. I still like to start IVs. I like putting epidurals in. I like all of that stuff. So it really sort of picked me, and it's just been a transition. When I started doing obstetric anesthesia, that was really something exciting, because just imagine, Mike, a woman comes in, she's in terrible pain, maybe the worst pain she's ever experienced in her life. Within 5 minutes, you've made her comfortable and safe, and she can have a really nice time and a great delivery. I mean, that's just amazing. And I'm actually very privileged and honored to be able to do what I do.
Wow, that's great. I like that it found you. That's I think you're right. I remember when I graduated law school, there was no part of me that said, "Oh, I'm going to go work for Tony Robbins and be a motivational speaker." I remember people thought I was crazy, but things in your life, I always say the universe works in funny ways, right? It's the law of attraction. What do you put out to the world that comes back to you? So the fact that something finds you, but it's the passion that aligns. So I got to ask you that question though, because, and we'll get to that in a second. My wife, she's been through what you do, and I'll get to that. We have a 12-year-old son and a 9-year-old son, both C-section, and that was by it more out of emergency, frankly. But what's the one thing, like if you had to say there's one element of your job, like that thing, it's like that purpose and that why, I talk a lot about that just drives you, it gets you out of bed, it keeps you fired up, and it keeps you going in what you do, what would you say?
Well, the first thing that you said about my job. So I don't consider that I have a job. I have a career. Not only do I have a career, I have a craft. I get to practice a craft that is so unique and so exciting and so personal in what you're doing. And that, every day when I still see a baby being born, it's still a miracle to me. I mean, every single time you look at it. We had quadruplets a couple of months ago. How many people have been able to see quadruplets being born? So, when I go to work and when I'm doing it, it's the knowing that I can deliver, I can safely deliver, and safety is extremely important, obviously. Safely deliver an epidural, a C-section, take care of a mom and her baby. And that's super rewarding. And the privilege that I get to do that, but they barely know me. They got to trust me from the very beginning. So I take it very seriously. And it's just such a privilege, and to be able to watch and be a part of all of that.
One thing, and I have a lot of doctors I've coached over the years, especially in your line of work. I'm always intrigued because I know everyone, I don't care what surgery it is. I don't care if it's a C-section, delivering a baby, whatever it is. Everyone in that room is important, 100%. Everyone has their role. It's amazing to me what you guys do in medicine. It blows my mind. But like you're the one that's kind of like the ninja behind the scene. Like no one gets to see you, maybe not, and then they're out. And then maybe you're gone and they don't get to, you're not the front point of contact. Like to this day, Steve, true story. The anesthesiologist that helped us, the morning rep was in an emergency situation. We went to emergency C-section. I still don't know that person's name. I kind of remember what he looked like, but what is that like? I mean, knowing that you're doing incredible things for the patient, but you're kind of behind the scenes, right?
Well, that's part of it, but you are missing out on a certain relationship that the patient has with their obstetrician or their surgeon that they've seen made for many, many months, perhaps, or many weeks. That is missing something. But on the other hand, you're in on the just meeting them and the trust they have in you to take care of them and safely get them through is just a different thing. And yeah, you're right. They don't remember your name, and we're all used to it. And it's like, that's just part of the deal. That's fine. That's no big deal. Did you go through safely? How did you feel? Hey, doctor, I didn't get sick, or I had a great experience. There's the reward in it.
Yeah, that's great. That's great. All right, well, let's get to this. I want to get down. I got lots of questions. So the question that was thrown my way is it was a text and said, "Hey, Mike, you've interviewed doctors and lawyers and other people. Tell me how this one came to be." And there's always a passion behind it. So opiates, okay, major problem in our country. Major problem. It's gone like this direction during COVID. We've seen what's happened in 14 months of behaviors, whether it's violence in the home, drug use, alcohol abuse, because people are penned up no matter what part of the country you're in. So opiates has always been something that's near dear to me. And here's why. My sister passed away 2 years ago. She was 50 years old. She battled addiction most of her adult life, depressed. I mean, my dad and I, our family did many things to try to get her help and rehab. And to this day, we're not sure exactly what was the final thing that took her out, but we all know that addiction was still in her life, and that will to live at 50 years. Very sad. It was very tragic. We didn't expect it. So that moment on, when I was talking to people like you or Dr. Dave Dahimi, who does opiate, addiction specialist, this was like something I felt like I had to bring to the forefront. So when you were telling me some of these stats, and I want you to talk about this, how many C-sections happen in the country, you have that data, I think, and then how people first become addicted to medicine and how that ties into your world. Once you started talking to me about that, that really came home to me, because that's not something that was on my mind 12 years ago when Monica had to have an emergency session. Never crossed my mind that, a working professional mom who's, clean and sober, if you will, I mean, she's a normal person, might have that potential challenge. Never crossed my mind. So can you speak to that a little bit? Because this is something people need to know about.
Yeah, this is a very important topic. And Orange County, California, it is one of the counties, a center of addiction and opioid abuse and use. And unfortunately, what happens many times, Mike, is that they get their first exposure after a surgery. Okay, there's 1.2 million C-sections that were done, I think, in 2019 in this country. That's a lot of surgery. And I just was working, I don't know if Jeanette is on this call. She works with Dr. David Adhemi. She's a labor and delivery nurse, and she's fantastic. And she works with addicted people also. And I was working with her in labor and delivery just a couple of days ago. And she told me that between 1 and 2 women that she sees that are addicted, between 1 and 2, 10 to 20% started after a C-section. So it's a problem. And what can happen is you can start, you're having pain, you have it left over in the cabinet. So it's something that really needs to be addressed. And I was fortunate a couple of years ago, I was at a meeting and someone was doing something with this drug called Exparel. And Exparel is basically just a local anesthetic that dentist uses, but they put it in these special fat molecules. So when you inject it, it lasts for 72 hours. So there was a guy, his name's Dr. Baker, great guy from Texas. They had a little booth there and they were talking about this procedure. It's called a tap block, TAP. When we say block, when we talk about blocks, that blocks the nerve. So any type of block, epidural block, spinal block, you're blocking the nerves, okay? So this block, transversus abdominis plane, it's a mouthful, we call it TAP, tap block. He said, here's what we do. After the C-section is done and the patient is still numb, and they're still awake, we use the ultrasound. The ultrasound women have seen, you've seen women get an ultrasound, the same sort of probe. You use it and you use it on each side of the abdomen. There's a plane there. You look at the muscles and you have a needle in the ultrasound and you put it in a special place and you put this drug in, this Exparel drug. And what happens is it doesn't make you numb. It doesn't make you groggy. It doesn't make you weak. You don't even know you have it, but it relieves pain from a C-section for up to 72 hours. And at first I was like, really? That really works? He goes, yeah. Now listen, Mike, we get bombarded. When you're out in private practice, you get bombarded with all kinds of stuff. We're busy. We don't have time to really check. You see ads in the journals, you hear people talking about stuff. It's hard to really get traction. And if you're going to take your time, and ideally, hopefully it's going to work out. So I was able to, after about 8 months of rigmarole at the hospital and stuff, being able to bring this drug and bring that procedure to our hospital in Orange County. What's really interesting is that I went to the foundation of the hospital and I told them what we were doing. And I said, we can help reduce opioid use. Will you help us to help pay for this medication? And immediately people who had relatives or a daughter or a son that had been affected, they were starting to donate money because they're like, this is a really good thing. So we have seen such a dramatic decrease in the opioid consumption in C-sections at our hospital. It's just been remarkable. Like some cases down to 0, some down to 80% reduction, just amazing. So think about, you may be eliminating 1 or 3 or 5 or how many people in a year from ever really getting exposed or ever really getting addicted to opioids. So That's a big deal. And this is a really exciting project that I've been able to be a part of. And it's a team approach. Let me tell you, it's not just me. It's a whole team. We've got a great team at Saddleback Hospital.
Wow. Well, another text that I got was from a friend saying, "Hey, is this for me? I got this invite. Would it be relevant for me?" And the truth is, his wife is 5 months pregnant. I said, "Absolutely, you should have her jump on just to educate herself about what she's about." First time mom, by the way. So when you're a first time mom, it's first time parent in general, right? You don't know what's going on. You've never been through that life experience. So my question is, and that's why educating people I think is so important. Thus, one of the reasons why we're here. I wasn't told about this. Like this is 12 years ago, maybe it even wasn't around, but is this becoming common practice for somebody to sit down and say, by the way, here's what's going to happen on the day of, or here's all the possibilities that could take place? Because frankly, I didn't know about this until you told me. So is this becoming more common practice to be able to ask for this, or are doctors just starting to bring this into the norm? Tell me about that.
Well, it is becoming more common practice. And I would say, it's not that common. It's not uncommon. It's not that common. But here's the thing about getting the word out about and when I talk to other physicians at other facilities, here's what I tell them. I said, look, don't take my word for it. Try it on 10 patients. Try this and see what you think. Because that's what we did. We originally were just able to use it on 10 patients because of certain restrictions at the hospital. We used it on those 10 patients. We never stopped, Mike. We never looked back. And that's been over a year now. And it's been fantastic. And I'm talking to other doctors and I'm trying to get the word out about it. So like I said, that's the kind of thing. It's like when you come out and you're in private practice, you're inundated with stuff. It's hard to get traction and ideas put forward unless you're really attentive or you have someone like me that says, hey, try this, or someone tries me. So it's not that easy to change your practice, but it can be done. And doctors are great about, once you're a doctor, you're an educator, you're a student for the rest of your life as a doctor. You have to be, to keep up on stuff and know what's going on.
Yeah, and I think it's really fascinating that you're taking the world that you're in and you're talking to a friend that's in addiction medicine, like the conversation you had last week, and sharing that knowledge. Because I think sometimes we don't think about, in your line of work, I mean, now because of things like this, education and journals and stories have been written about you, right? Where you get to talk about these things, you're educating someone that might not think of that way. So if there's anyone out there in practice, or whether it's hospital administration, doctors, surgeons, whatever, thinking about this, like we don't stop and think about what's the possibilities of this. So when it's only one or two people who might become addicted, but when they weren't expecting it. By the way, interesting. The other one I think she had told you was oral surgery. Did she say oral surgery?
Yes, oral surgery
or C-section. So think about someone who's an addict, was previously healthy, and their first entree to opiates is either a C-section unexpectedly or it's oral surgery. Again, things I never would have thought of.
Yeah, and the other thing about the drug, when you do this tap block, first of all, they're using much less opioids, which means they're going to be able to move their bowels faster, which means they're going to bond with the baby quicker, which means they can get up out of bed because they don't have pain. They're more active. They can get out of the hospital earlier. They can get their Foley catheter, a urinary catheter. So there's so many things that just pile on top of just that. When you look at the whole thing, I mean, and when we first started, the nurses were going like, this is unbelievable. I had to tell a patient, one of the nurses said, Dr. Garber, I had to tell a patient, please don't jump out of bed. You just had surgery. Please don't jump out of bed. I'm like, wow, okay, that's great.
Yeah. So I guess the word is we got to get the word out. We got to educate people about this thing. So even for patients out there and they're not in the know, be able to ask those questions of your doctor and say, hey, is this an option for me?
Yes, absolutely. And we are getting the word out. I've had patients that come in and I start talking about the tap blocks. He goes, I know I want it. I'm on the Facebook group of the moms of Orange County. And I already heard that your hospital, that you guys do it. I want it. Like, there's social media working on positive, right? Not always a positive, easy, but there is a positive. Like, that's great. The word is out there. It's getting out there.
That's great. So real quick, since you brought that up, I know this because I have a confidential relationship with you, so you can divulge whatever you'd like. I'm proud of you, so I like to brag on you a little bit. Can you share with people some of the things that you do outside of a webinar? I mean, this is one mean of communication. I know there's, whether it's speaking, writing, social media. What are some of the other things you're doing out there? I know we had an exchange last week. You're in demand. People want to hear what you have to say. So what other ways are you getting the word out there to communicate the things that you're passionate about?
Well, I'm working with, we're going to talk about Ravana. I'm working with Acuro. I'm working with the Pacira, the company that makes Exparel. And I've got some other things in the fire. I'm always trying to look at things in my field that I think that would bring value. And here's what I tell people. Look, I'm a seasoned obstetric anesthesiologist. I've been doing it a long time. If I tell you about something that I think is probably going to help you out, it's probably going to help you out, because if it can help me out, it's probably going to help you out, because I've seen it all and kind of done it all. And I'm not trying to brag, blah, blah, blah. I'm just saying there's things that make you more efficient, that maybe make you to be safer, that make you a better anesthesiologist. Look, we all want our craft. We all want to improve our craft and be the best that we can be. And the technology stuff is going on out there. You got to be able to sift through it and figure out what's good and what's bad and what's real and what isn't. But when you find some stuff, it's really cool. It's like going through the treasure chest and you pull something out and go, this is really cool. I got to see what my colleagues think of this, and then let's run with it and introduce other people to it.
Yeah. Well, before we get to the second topic that's near and dear to me, which I know you're going to talk about, I want to ask you a question more about entrepreneurship and medicine. Like I mentioned, law school, med school, they don't teach us those kind of things. You kind of figure it out, or you have a role model, or you get brought into entrepreneurship. So if there's other doctors out there that are listening to this or see this, speak to about the entrepreneurship, right? What is it? What do you got to do? Because I know in my coaching role, the doctors that usually get attracted to me to hire me as a coach, they don't hire me to become a better doctor. They usually hire me and say, look, I want to be on a stage. I want to write. I want to have a different company. I need to invest. I want something different because I've been doing this for 30 years, 20 years, right? So
Right.
Speak to that a little bit, because I know you made that jump, right? From, hey, I'm just a doctor to I'm an entrepreneur. So there's other people out there that are maybe listening going, I want to be more like that. What did it take? What was the belief? What was the process for you mentally to make those jumps and to have the courage to follow your passions?
Well, that's the key when you said passion. So when I found Exparel, I started using it, and we'll talk about the Acura. When I found the device and the drug and the procedure, the passion about it. When you're passionate about it and you're like, this is so cool. I gotta tell, it's like when you hear a great song, when you call your girl or your whatever, go, you got to listen to this song. What do you think of this? So it comes from the passion of knowing that, like, when I'm behind something and I want to spread the word, you got to believe that I really believe in it. I'm not just kind of like, oh yeah, try this out. I believe in it. I want to spread the word. I'm excited about it. I want to spread that enthusiasm. Now look you may try it and go, Steve, this doesn't work for me. I'm like, okay, maybe you tried it. So try it and see what you think. So that's the main thing, is the passion. And when I saw, well, I've got this passion, I want to be able to tell people about it. I want to get involved more. And then the natural evolution became, I talked to you, and then all of a sudden here we are now. So that's how it comes. The seed is the passion, the willingness to share, understanding what you're doing, making sure that you believe deeply in it, and that it's for the better, for the good that you believe, and then go from there and see what people think. Put it out there and see what happens.
Yeah, it's so true. And that's what I share in my coaching with entrepreneurs in general, is you have to lead with contribution. You're giving. It's not take, it's not hired gun, it's not money, right? It's about giving. And when you lead with contribution, it's one of the 6 human needs, right? You have love and connection, significance, growth, certainty, right? Contribution is number one when it comes to putting your name on something. I know that's really important to you, Steve, is your brand equity, your brand protection, putting your name on something. It's not something you're just going to do. It's going to be something that you believe in and something that you're passionate about.
Let me tell you just a really quick anecdotal story. The very first patient that we did this tap block, and I didn't even know how to do these tap blocks when we started. I learned, and I'm an older guy that we didn't get this training. And I tell people, if I learn to do it, anyone can learn to do it. Okay, you can learn to do it. That's something it's a mental block for doctors. I don't want to learn that. You can learn to do it. Anyway, we had someone else do the block. Our very first patient. This gal was Amy. And sophisticated. She had a terrible C-section, her first C-section. She had practically almost a bowel obstruction from the opioid, with which she couldn't really move her bowels. It was terrible. She was afraid to have another C-section. She was a great candidate. We did this block. I called her a week and a half later and I said, how are you doing? She goes, Dr. Garber, when am I going to be in pain? I go, what do you mean? She goes, I'm just waiting to be in pain. I go, you're all done. And she started sobbing on the phone. She was so thankful for what our team had been able to provide her with. Now that to me, that is showing, that's like, this is why you do it. This is the reason why you do stuff like that. And for an anesthesiologist, it's unusual for an anesthesiologist to bring transformational changes to a practice. And this was a complete transformational change in post-operative C-section care. So right there, you're getting rewards. And then that's just happened time and time and time again.
Yeah, that's great. I appreciate you sharing that. I love stories. Testimonials are reinforcement to why we do what we do, right? So thank you for sharing that story. All right, so let's get to the next topic, which is near and dear to me because of the experience I had with our first son. We had originally planned to have just a regular routine, labor, go through everything, and then let Monica labor for close to 16 hours. Our doctor, who we're extremely close with, comes flying in and said, we got to get that baby out of here now. And of course, throws me in my garb. If you want to come in, great. She's all of about 5 foot. She's a fireball from New York, right? And I got scared. I freaked out. I'm like, this is not the plan. This was not the plan, So, but hey, I trust her, and it is what it is. So they're wheeling Monica out, and all these things were happening in that moment. But I remember the night before, when everything was kind of smooth and everything's happening, and she had to make the choice whether or not she wanted to have the medication or not. And I remember that doctor, or whoever it was, I don't remember the person's name. It wasn't our primary, when they were trying to alleviate her pain, wasn't happening, right? It literally took like 4 or 5 different pricks, if you will, on her back to finally get her to where she was comfortable. And I remember all that whole 24-hour period of course, having my first son was the end product and everyone's healthy at the end of the day. It was great. And it makes all the other stories go away. But when you started telling me about some of the other things you're doing, again, something I didn't know about at the time, I wasn't educated about it. Now I do. This is a big problem, right? I mean, the Monica story of not finding the right spot to get the needle where it needs to go. That was something I experienced. And I literally watched this go on for 20 minutes right in front of my face, frustrated, thinking, what is happening? Why can't they figure this out? So finally, one guy came in and he did it at first move, walked out. He was like the coolest guy in the room because guess what? The alleviation of pain. So talk to him a little about this, because this is more common than I think.
Yeah, so I stumbled upon, at that same meeting with the expert, I stumbled upon this company that makes this really super cool device. This is called the Accuro spinal navigation device. And basically it's a handheld ultrasound. We've been talking about ultrasound this whole time. An ultrasound at the end that does an ultrasound on the back. Now look at Mike, I've been doing OB anesthesia for a long, long time. The majority of the time you don't need help finding the epidural space, but sometimes you do. Sometimes you can't find the exact space. And what this great tool does in a matter of like a minute, it helps you find the place to go. Basically what you do is you turn it on, you put some gel, you put it on the patient's back. Here's their back, you put it on and you look at the screen and it has a little device that goes on to help you mark the spot, and X marks the spot, and there you go. Again, this is something that I found useful. And I said, okay, and I put it out for my colleagues. Our friend Dave Dahimi, once a month, he says, Steve, that actor is just awesome. I just love that thing. Thanks for finding that thing. So this is now in our tool chest. Okay, it's not something you use every day, but when you need it, it's great. It helps you find the space. 3 a.m., you're up doing an epidural, it's tough, you pull that out, and I've become a champion for this company. I was just at a hospital yesterday, delivering a sample for them to try, and they were very, very excited. They'd never seen anything like it. So, again, it's finding something, that is useful. And I'll tell you a quick anecdotal story about Zoe. Zoe was a patient. She'd had a very bad car accident when she was like 18. She's now 20, 28, 29, her first baby. She's got metal up and down, back surgery, scar, everything. Very nervous about having a baby, wants an epidural. She's had enough pain her whole life, doesn't want any pain. So I took this to her doctor's appointment when she was like 25 weeks pregnant. Can you do a consult? I go, yes, I brought this. I scanned her in the doctor's office and I said, yeah, it looks like we'll be able to do an epidural. She said, really? I said, yeah. Let me tell you, there's no way without this device I could have done that. She came into labor. I was able to put an epidural in. She had a great labor and everything. Super thankful. That's the kind of stuff that it's the next level for your craft, because normally I would have said, I'm going to try. I don't think there's a good chance because I can't feel anything. There's scar tissue, there's metal. With this, it accurately identified where I needed to go, and I got the epidural in. And I'm very, very thankful for the device. I was on, I used this 5 times when I was on a 24-hour call. And that's not because I'm inept. I know what I'm doing. I did 13 epidurals, and 5 of them I needed this device, and it worked great.
Well, I can tell you, the patient doesn't want to be, pricked 5 times. That's a painful experience in and of itself. So me watching that, I was like, oh my gosh. Again, your respect for your motherhood goes up every minute, that during that 24-hour period when you're delivering a baby, and not to mention the 9 months leading up. But that when you look at something like that, it's like, why wouldn't you have that? If you could try to be egotistical and say, oh, I'm really good at what I do, watch this, or you can have something like that because your ego and pride's aside, you're actually thinking about the patient. Right? Because you have probably different situations, people's body type, metal in their back, maybe issues that you said, scar tissue, obesity. I mean, I'm imagining that all the different types of body types you'd see, this gets rid of everything. So there's nothing that could prevent this from working, right? I mean, this is like something that works on everybody.
Again, nothing works 100% of the time, but it certainly improves your odds drastically to really help you. Absolutely.
Wow. That's great.
And they're working on they're continuing to develop new software and new stuff. It's a great company, really, really fun people. And again, they're excited. This is the story of, they started it like in the attic, with soldering some wires. It's one of those great entrepreneurial stories that people are fantastic to work with. Just like with Pacira, that all the people are fun, they're excited, they want to get the word out. And that's something out of your routine in the operating room, your colleagues and stuff. They want to come in, you do your stuff, you're surrounded. And that's the other thing. I'm out meeting all kinds of really cool people that are excited about stuff and like, hey, let's get this done and this done. And what about this? So that's the other part of this that I didn't realize, is meeting all these great people like you and the excitement of it.
Yeah. Thank you, man. Well, hey, one question I have to ask is I'm sure there's got to be other things that you're moving towards. This is not the end of Steve, is, a couple of different things. You probably have other trends or things that you're seeing, whether it's technology. Can you speak without giving away things? I don't know what you have, going on, but
share with
us some of the other things that are happening in the world of your world anesthesiology that you can share with us.
I'm working right now. So when you do an epidural, okay, what you do is you have an epidural needle and you put that in the back, and then you have a syringe. And when you're putting the syringe, you're pushing on the syringe because it has water or air in it. And when you get to the epidural space, what happens, the syringe goes in, and then you're in the space. Well, I'm working right now with I'm just going to tell you a special type of syringe that is really cool, that helps you find the epidural space with doing much, much less work. I'm just going to say that. I'm just getting started, and I'm looking at this going, this is really exciting. This is super cool.
That's
awesome. I can't wait to get more involved. Again, you can see I'm just like, yeah, okay, right, let's go. And this is what I'm finding that I'm just good at, is that if I can find something and I get samples or something, I can go, try something out or have my buddies like, this is really cool and important. Let's get the word out here. And I can help do that.
I love it. I love it. Before I get to some questions, we do have some questions coming in. I'll make sure we hit the questions. Do you have anything that you can share just in terms of life skills? And this is kind of like a lob question that you didn't know was coming. So I know it's maybe hopefully not a curveball, but I'm big on that, right? So when I talk about modeling is the duplication of success, and you're talking I'm not just talking about as a doctor, as a human being. Do you have a couple tips for us out there? These are even my friends that are they're not pregnant, they're not doctors. They'd watch this and say, how does this guy become successful? Like if he had 2 or 3 tips for me as a human being to be a better person, what would they be? What would you say?
Well, Mike, I've spent a lot of time listening to a lot of podcasts and watching videos. Joe Dispenza, Wayne Dyer, Tony Robbins, all of these people, and they're all saying the same thing essentially differently. Okay. And I think one of the most important things that you can do is train yourself to think a certain way. And that saying that came, I think probably maybe the Old Testament or something, is As you think, so shall you be. And I think that is one of the most important things. If you can imagine yourself, if you can think, look at, they've done these experiments where they're doing a PET scan of your brain, and they imagine you drinking water, and you imagine, they look at what your brain does. And then when you're drinking water, your brain is the same activity. So it's like, wait a minute, I'm imagining it, the same thing has happened. So if you use your positive, and I'm not just saying positive thinking, I'm saying changing the way that you're thinking. As you think, so shall you be, is put yourself in the, like, where do I want to be? I mean, I've thought lots of times, here's where I want to be. I try to focus on the positive and the energetic stuff that's going to move me forward. And for me, that works. And that's what I would encourage. Look at those people that are just, the Tony Robbins and the Wayne Dyer and the Joe Dispenza. Listen to their stuff. See what you think. It's really impacted me in a very, very positive way. And you ask people and friends around me, they were like, dude, you're on fire. What are you doing? And I tell them, this is what I do. And I try to be grateful every single day. Gratitude is so important to me. Every single day, being gracious for all the things, the people, and the things that I have. I think those two things, the way you think and to be gracious.
Yeah, that's great. Oh, by the way, that book up there, As a Man Thinketh, that's by James Allen. That's one of my books in my backdrop. That's basically what it is, As a Man Thinketh, and it's Therefore I Am. So when you actually read that book, and I didn't put that up there for this, that's been up there for a year and a half because that's one of my favorite books. Right. It was gifted to me with a handwritten note from a dear friend of mine, and it ensnares and captures everything that I believe. Whatever you believe, you'll achieve. Whatever you put out to the world will come back. Whatever you think, where energy flows, it grows. All those things are tied together, and it's right there in that book. So if you don't have it, James Allen, quick read. It's probably 50 pages, but you hit it, man. That's unscripted. Thanks for nailing that one for me, buddy. All right. So let's get to a couple questions. One question that I thought was really interesting. Let's see, Mary. She said she would like to ask you, do you see Exparel being as efficacious in this population? She talked about with opioid non-naive tolerant mothers during C-section. Does you see that Exparel being as efficacious in this population? Number one, what difference does he consider in his pain protocols approach with the patient population? Great question.
Okay, Mary, thanks for that question. And just let me distill a little bit. So let's say you have a mom who's been taking some pain medication. Maybe she's had some sciatica. Maybe she's had a problem with Norco or one of the similar ones. So her tolerance. So what that means is that if you give her the regular dose, she's not going to get comfortable. Then you're going to have to be going up higher doses and higher doses. Then you're going to start getting into respiratory depression. So is Exparel useful in these patients? Absolutely. Because if you can just keep her with no pain, she's at the same level, her tolerance, she goes, okay, I need to take it or I don't need to take it. Now, are you going to be, you're not in there to treat her tolerance or her problem. Maybe she does have a problem or not with opioids, but you can make it so that she's not then going up on the level and developing a further tolerance and making the problem worse. So yes, absolutely, Exparel is very advantageous. And if you have patients that come in, we definitely want to use it in those cases.
Yeah, so I mean, that's another question that I kind of had, when somebody has, let's say someone already, I mean, a very similar question. I think it's a cousin of the question, but I want to be clear. Yeah. So if somebody already had an opiate issue and they're pregnant, I mean, how does that come into the conversation? I mean, do you, I mean, is it protocol that I know you have the checklist, are you doing these drugs, but a lot of times addicts lie. I mean, that's a very common thing. My friends in addiction tell me that. I'm not being disrespectful. That's the truth. Right. So right. How do you break through that? I mean, obviously this is helping someone who's already has an opiate addiction, but how do you approach that conversation, or does that conversation ever take place? I'm just curious.
Well, that's a very good question. And we have at Saddleback Hospital and with our system in general, a robust questionnaire right from the beginning, because we want to know without being judgmental. Excuse me, we want you to be safe. We want to take care of you. You have to give us the information. We're not going to judge you. We're going to help you. So we can get people involved. We can send them to an addiction doctor if they need. Maybe there's medications they need to be on to help block so they're not using it. So most of the time we are aware, and that's really important to be aware, because once you're aware, then you have different protocols. You can use non-opioid, you can use Exparel. There's a host of other things as once you're aware to do it. So yes, we are able to identify these patients earlier, and take care of them better because of their willingness to trust us and with our armamentarium of things in the tool chest to take care of these patients.
All right, good. All right, another question was, what message for Dr. Steve to practitioners who want to get out there and start adopting new technologies? Great question.
Yeah, well, I think you have to have your initial interest, and you got to contact someone that's doing it. Someone that's like, if you wanted to ask me and find out about the Acura, or that you go onto LinkedIn and go, hey, I saw your profile. What can you tell me about this? Or I'm interested in this. Go, now with the World Wide Web, you can pretty much find anything. Hey, who's using this? And look I've got colleagues all across the country. And this is really exciting, that are using stuff, and maybe they're using something I'm not, or I'm using some, and we talk and we chat and we go back and forth. So you can find people. There's people out there and they want to tell you about it. They want to chat about it. They want to help you find a way. So there's a lot of resources. You just have to be willing to ask the questions, and you have to be willing to dive into it. And maybe you have to be willing to try it. This is the whole thing. And this is part of my thing, is like, if you want to try this, I'll help you. I can help you in your hospital system get going. Try it. If you don't like it, then don't use it. That's it. But just try it. If you want, you got to be willing to try stuff.
Yeah, I love that. That's my this, Steve. My rule number one in coaching is don't judge, be curious, right? And when you're curious, what do? You ask questions. You don't arrive at verdict or judgment. You keep asking. What else am I not seeing? What else is out there? Who else has a better idea? Who could I model? Great questions lead to great answers. And I know you believe that. I know I believe that. And you would be doing these things if you had judgment. If you were open-minded and curious about what else was out there, you're going to attract partnerships. You're going to attract passion. So hats off to you for having that belief. I love that belief myself. I don't think we had any other questions that came through. I wanted to leave with this. I know.
Well, before you say that, I want to tell you, here's the thing that Mike has taught me. This is the one thing, and this has just opened up so many doors for me. Everything that happens, it's a disaster. Where's the opportunity? Where's the opportunity, Steve? I hear Mike in here. Where's the opportunity? Okay, there's always an opportunity.
Yeah.
In any situation, there's an opportunity. And if you ask yourself, then you're going to start looking for it, and then you're going to find it, and you're going to be really surprised. Instead of being like, oh man, this is like off the, like, okay, where's the opportunity here? It gets your mind going, your body, it gets you off the thing. And that's one thing I credit all to Mike.
I appreciate that. One thing I've conditioned myself since my Robbins days was just being a good question asker of myself. I mean, I like to do that with people because I like to be a good conversationalist and provoke thought with people. That's what coaching does. But for myself, when I'm struggling or I'm challenged, I always ask myself, what am I not seeing yet? What am I not seeing yet? Yet means there's something there. I got to keep finding it, right? Don't judge it. Be curious. What's the outcome? What's the opportunity? And what's great about it? Those are my top go-to questions for myself when I struggle with something. It doesn't matter what it is. I can get a letter from the IRS, which I did 2 years ago as a mistake. And I'm reading this letter and I'm like, this can't be right. This can't be right. But I'm thinking, what's great about this? What's great about it? It made me rethink some things in that moment, even though it turned out to be a mistake. The fact that you have something in your life that triggers an emotion, a life experience, good or bad, you still look at that situation and ask that question. What's the opportunity? What's great about it? What am I not seeing yet? What's the outcome or what's the expectation? So thank you for highlighting that, Steve. Appreciate that. All right. So we're going to wrap up. So Steve, I know you're big on LinkedIn, right? You want people to see you on LinkedIn. You can see your profile, all your different affiliations, all the letters after your name. Can you tell us about your LinkedIn? What is it?
It's Steve Garber, anesthesiologist. I think if you search Steve Garber, anesthesiologist, you're going to see you'll see my profile on there and the stuff I'm doing and interested in doing and the people I'm connected to and let's connect. I mean, I'm connecting every day to people all over the world, and that's what's so great, the connections that you can make. And that's how I made this connection with this syringe that I'm working with. It was just a random someone on the other side of the world. And now we're getting to work together. So there's lots of opportunities out there. You got to be able just to put yourself out there and do them. So yeah, you got questions about anything we've talked about today, you can message me on LinkedIn, find me there. I'm more than willing to get down and answer those questions.
Great. And I'm the same way. I connect with everybody. My belief system is if you connect with me, I don't know who you are, you don't know who I am, but we have people in common. Let's connect. I've in my 10 years of using LinkedIn, I've never denied a LinkedIn request. Never. LinkedIn is their community is very good about protecting selling and pitching and all that stuff. So I know it's a safe place for entrepreneurs. So by all means, I love it when people connect with me. It's Mike Lindstrom. I think it's Mike Lindstrom, JD. You can see my bald head. I don't think in my picture I had the glasses on at the time, but I'd love to connect with you. I know Steve would love to connect with you. My email, if you want to connect with me, is mike@mikelindstrom.com. It's got a D in it. It's probably, you'll get it on the invite or the post wrap up. Zoom will send out a confirmation for you. We'll have this recorded. If anybody wants to hit me up and say, hey, Mike, I had 2 colleagues that couldn't make it. Can you send me the recording? What I typically do is record the Zoom, put it up on my YouTube channel. So it's opened up to the public domain. Steve and I will promote it on LinkedIn, social media, et cetera, in the days to come. So if you have anybody that couldn't make it, no sweat, we'll have the recorded version out to you on LinkedIn. So Steve, thanks so much for taking the time. And any parting thoughts before we let everybody go?
Well, Mike, I just really wanted to thank you for the opportunity to be able to talk about the stuff I'm doing. And, again, I think there's opportunities out there. There's stuff going on everywhere around us. When we get sort of pigeonholed about our lives and what's going on, open yourself up to one new idea, maybe one thing like, hey, I wanted to really try this or look into this. Go do it. Just take some time and do it. And you'll find yourself in a whole different world sometimes. It's really, really fun and exciting.
That's great. All right. Well, we're signing off. Steve, thanks so much. We'll talk this week and we'll get this recording out to everybody this week. Thanks so much, Steve.
Okay. Thank you, everyone. Thank you so much for joining. Really appreciate it. All right. Bye.